Welcome to our video on essential nutrients and good supplements for women. Today, we'll be diving deep into the world of women's nutrition, exploring key vitamins and minerals that play crucial roles in supporting overall health and well-being. We'll cover everything from iron and calcium to omega-3 fatty acids and probiotics, discussing their importance, recommended intakes, and the best supplementation strategies. By the end of this video, you'll have a comprehensive understanding of how to optimize your nutritional status and make informed decisions about supplementation. So, let's get started on this journey to better health. Iron is a cornerstone of women's vitality, especially for those who menstruate. This essential mineral is crucial for forming hemoglobin, which carries oxygen throughout the body. Women of reproductive age are at higher risk of iron deficiency due to blood loss during menstruation. The National Institutes of Health recommends that women aged 19 to 50 years need 18 milligrams of iron per day, while those over 50 require 8 milligrams. Pregnant women have even higher needs at 27 milligrams daily. While you can find iron in foods like lean meats, poultry, fish, legumes, and dark leafy greens, it's important to note that heme iron from animal sources is more readily absorbed than non-heme iron from plant sources. A study published in the American Journal of Clinical Nutrition by Camashella in 2015 found that iron deficiency anemia affects up to 12% of non-pregnant women aged 15 to 49 years in developed countries. Signs of iron deficiency can include fatigue, weakness, pale skin, and shortness of breath. If you're considering iron supplementation, it's crucial to consult with a healthcare provider first. Excessive iron intake can lead to adverse effects, and iron supplements may interact with certain medications. A blood test can determine if supplementation is necessary. Moving on to calcium, this mineral is essential for maintaining strong bones and teeth throughout life. As women age, particularly after menopause, the risk of osteoporosis increases, making adequate calcium intake even more critical. The NIH recommends that women aged 19 to 50 years need 1,000 milligrams of calcium per day, while those over 51 require 1,200 milligrams. You can find calcium in dairy products, fortified plant-based milk alternatives, leafy greens like kale and collard greens, and calcium-set tofu. However, many women struggle to meet their calcium needs through diet alone. It's worth noting that calcium absorption is influenced by several factors, including vitamin D status, age, and the presence of certain compounds in food. A study published in Osteoporosis International by Heaney and colleagues in 2003 found that calcium absorption efficiency decreases with age, particularly after menopause. When considering calcium supplementation, it's important to balance the potential benefits with the risks. While calcium supplements can help meet daily requirements, excessive intake may increase the risk of kidney stones and cardiovascular events in some individuals. The current consensus among experts is to obtain calcium primarily from dietary sources when possible. Now, let's talk about vitamin D, often called the sunshine vitamin. Vitamin D works synergistically with calcium to maintain bone health, but its importance extends far beyond skeletal integrity. This fat-soluble vitamin plays a crucial role in immune function, mood regulation, and potentially reducing the risk of certain chronic diseases. The NIH recommends a daily intake of 600 IU, 15 micrograms of vitamin D for women up to age 70, and 800 IU, 20 micrograms for those over 70. However, many experts argue that these recommendations may be too low for optimal health. While sunlight exposure is a primary source of vitamin D, many factors can limit its production, including living in northern latitudes, having darker skin, and using sunscreen. Vitamin D deficiency is surprisingly common, even in developed countries. A study published in the New England Journal of Medicine by Holick in 2007 estimated that 1 billion people worldwide have vitamin D deficiency or insufficiency. Symptoms of deficiency can be subtle and may include fatigue, bone pain, and increased susceptibility to infections. Given the challenges in obtaining adequate vitamin D through sunlight and diet alone, supplementation is often recommended. However, it's important to have vitamin D levels tested before starting supplementation, as excessive intake can lead to toxicity. Folate, also known as vitamin B9, is particularly important for women of childbearing age due to its role in preventing neural tube defects during early pregnancy. However, its benefits extend to all women, supporting DNA synthesis and cell division. The NIH recommends a daily intake of 400 micrograms dietary folate equivalents, DFE, for adult women, increasing to 600 micrograms DFE during pregnancy. You can find folate in leafy green vegetables, legumes, citrus fruits, and fortified grains. However, the bioavailability of folate from food sources can vary, and many women may not consume enough folate-rich foods consistently. When it comes to supplementation, it's important to understand the difference between folic acid and methylfolate. Folic acid is a synthetic form of folate, commonly used in supplements and fortified foods. However, some individuals have genetic variations that affect their ability to convert folic acid to its active form. Methylfolate, the active form of folate, may be a better option for these individuals. A meta-analysis published in The Lancet by D. Ragel and colleagues in 2015 found that folic acid supplementation reduced the risk of neural tube defects by 72%. This underscores the importance of adequate folate intake for women of reproductive age. The B-complex vitamins play crucial roles in energy production, brain function, and the formation of red blood cells. While all B vitamins are important, B6 and B12 deserve special attention in women's health. Vitamin B6 is involved in neurotransmitter synthesis and may help alleviate symptoms of premenstrual syndrome, PMS. The NIH recommends a daily intake of 1.3 mg for adult women, increasing to 1.9 mg during pregnancy. Vitamin B12 is essential for nerve function and DNA synthesis. It becomes increasingly important as women age, as absorption can decrease. The recommended daily intake is 2.4 micrograms for adult women. You can find B vitamins in whole grains, lean meats, fish, eggs, and leafy greens. However, B12 is primarily found in animal products, making supplementation important for vegetarians and vegans. A study published in the American Journal of Clinical Nutrition by Smith and colleagues in 2010 found that B vitamin supplementation improved cognitive performance in older adults. This highlights the potential benefits of B vitamins for brain health as women age. Omega-3 fatty acids, particularly EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, are essential for women's health, supporting heart function, brain health, and potentially reducing inflammation. While there's no official recommended daily intake for omega-3s, many health organizations suggest consuming 250 to 500 milligrams of combined EPA and DHA daily. During pregnancy, the recommendation for DHA increases to support fetal brain development. You can find omega-3s in fatty fish like salmon, mackerel, and sardines. Plant-based sources such as flax seeds and walnuts contain ALA, alpha-linolenic acid, which the body can convert to EPA and DHA, albeit inefficiently. A systematic review published in JAMA Internal Medicine by Mozaffarian and colleagues in 2013 found that omega-3 supplementation was associated with a reduced risk of coronary heart disease in women. This underscores the potential cardiovascular benefits of omega-3s for women. For those who don't consume fish regularly, omega-3 supplementation may be beneficial. Fish oil supplements are a common choice, but algae-based supplements are available for vegetarians and vegans. Magnesium is involved in over 300 enzymatic reactions in the body, playing a crucial role in energy production, muscle and nerve function, and bone health. It's also important for mood regulation and may help alleviate symptoms of PMS. The NIH recommends a daily intake of 310 to 320 milligrams for adult women, increasing to 350 to 360 milligrams during pregnancy. You can find magnesium in nuts, seeds, whole grains, and leafy green vegetables. However, soil depletion and food processing can reduce the magnesium content of many foods. A study published in the Journal of Women's Health by Hruby and colleagues in 2014 found that higher magnesium intake was associated with a lower risk of type 2 diabetes in women. This highlights the potential metabolic benefits of adequate magnesium intake. Magnesium supplementation may be beneficial for women who struggle to meet their needs through diet alone. However, it's important to choose a well-absorbed form of magnesium and to be aware of potential interactions with medications. Now let's discuss some top supplements for women. Multivitamins can serve as a nutritional safety net, helping to fill gaps in the diet and ensure adequate intake of essential nutrients. For women, a well-formulated multivitamin can provide key nutrients like folate, iron, and B vitamins. When choosing a multivitamin, look for one that's tailored to your life stage. For example, premenopausal women may benefit from a multivitamin containing iron, while postmenopausal women typically need less iron but may require more calcium and vitamin D. A systematic review, published in the American Journal of Clinical Nutrition by Fortman and colleagues in 2013, found that multivitamin use was associated with a reduced risk of certain cancers in women. However, it's important to note that multivitamins are not a substitute for a healthy diet and lifestyle. Combined calcium and vitamin D supplements are often recommended for women, particularly those at risk of osteoporosis. These two nutrients work synergistically to support bone health. When choosing a calcium supplement, consider the form of calcium. Calcium citrate is generally well absorbed and can be taken with or without food. Calcium carbonate is less expensive but requires stomach acid for absorption and should be taken with meals. A meta-analysis published in The Lancet by Weaver and colleagues in 2016 found that combined calcium and vitamin D supplementation reduced fracture risk in older adults. However, it's important to balance the potential benefits with the risks, as excessive calcium intake may increase the risk of kidney stones in some individuals. Iron supplements may be necessary for women with heavy menstrual periods, pregnant women, or those diagnosed with iron deficiency anemia. However, iron supplementation should only be undertaken under medical supervision, as excessive iron intake can be harmful. When iron supplementation is needed, choosing a form with good bioavailability is important. Ferrous sulfate is commonly used, but it can cause gastrointestinal side effects in some individuals. Other forms like ferrous gluconate or iron bisglycinate may be better tolerated. A study published in the New England Journal of Medicine by Vorcher and colleagues in 2012 found that iron supplementation improved fatigue in non-anemic women with low ferritin levels. This suggests that iron status, rather than just hemoglobin levels, may be important for women's health. Omega-3 fish oil supplements can be beneficial for women who don't consume fatty fish regularly. These supplements provide EPA and DHA, which support cardiovascular health, brain function, and may help reduce inflammation. When choosing a fish oil supplement, look for one that has been third-party tested for purity and potency. The amount of EPA and DHA should be clearly stated on the label. A systematic review published in JAMA Cardiology by Ang and colleagues in 2018 found that omega-3 supplementation was associated with a reduced risk of coronary heart disease in women. However, it's important to note that the quality of the supplement and the baseline omega-3 status of the individual can influence the effectiveness of supplementation. Given the prevalence of vitamin D deficiency and the challenges in obtaining adequate amounts from sunlight and diet alone, vitamin D supplements are often recommended for women. When choosing a vitamin D supplement, opt for vitamin D3, cholecalciferol, over D2, ergocalciferol, as it's more effective at raising blood levels of vitamin D. The dosage should be based on individual needs and current vitamin D status. A randomized controlled trial published in the Journal of Clinical Endocrinology and Metabolism by Jorda and colleagues in 2008 found that vitamin D supplementation improved mood in women with low vitamin D levels. This highlights the potential mental health benefits of addressing vitamin D deficiency. B-complex supplements can be beneficial for women, particularly those following vegetarian or vegan diets, older adults, and women with increased needs due to pregnancy or certain medical conditions. When choosing a B-complex supplement, look for one that provides the full spectrum of B vitamins in their active forms. For example, folate should be in the form of methylfolate, and B12 as methylcobalamin or adenosylcobalamin. A study published in the American Journal of Clinical Nutrition by Walker and colleagues in 2012 found that B vitamin supplementation improved cognitive function in older women. This underscores the potential cognitive benefits of B vitamins, particularly as women age. Magnesium supplements can be beneficial for women who struggle to meet their needs through diet alone. They may help support bone health, mood regulation, and sleep quality. When choosing a magnesium supplement, consider forms with good bioavailability, such as magnesium glycinate, citrate, or malate. The dosage should be based on individual needs and current magnesium status. A randomized controlled trial published in the Journal of Research in Medical Sciences by Fathizadeh and colleagues in 2010 found that magnesium supplementation improved symptoms of PMS in women. This highlights the potential benefits of magnesium for women's reproductive health. Lastly, probiotic supplements can support digestive health and may help maintain vaginal health in women. They can be particularly beneficial after antibiotic use or for women prone to urinary tract infections or yeast infections. When choosing a probiotic supplement, look for one with clinically studied strains and an adequate colony-forming unit (CFU) count. Strains like Lactobacillus rhamnosus and Lactobacillus reuteri have shown benefits for women's health. A systematic review published in the Journal of Nutrition by Huang and colleagues in 2014 found that probiotic supplementation may help prevent bacterial vaginosis in women. This underscores the potential benefits of probiotics for women's reproductive health. In conclusion, while a balanced, nutrient-dense diet should always be the foundation of good nutrition, supplements can play a valuable role in filling nutritional gaps and addressing specific health concerns. The key nutrients we've discussed, iron, calcium, vitamin D, folate, B vitamins, omega-3 fatty acids, and magnesium, each contribute uniquely to women's health, supporting everything from energy production and cognitive function to bone strength and heart health. However, it's crucial to approach supplementation with informed caution. Supplements are not a magic solution and should not replace a healthy diet and lifestyle. The effectiveness and necessity of supplements can vary greatly among individuals, depending on factors such as age, health status, dietary patterns, and genetic predispositions. When considering supplementation, it's essential to consult with healthcare professionals to assess individual needs and potential interactions with medications. Choose high-quality supplements from reputable brands. Be aware of potential risks associated with excessive intake of certain nutrients, and regularly reassess supplement regimens as nutritional needs change throughout life. Ultimately, the goal of supplementation should be to support overall health and well-being, working in conjunction with a balanced diet, regular physical activity, adequate sleep, and stress management. By taking a holistic approach to health and making informed decisions about supplementation, women can optimize their nutritional status and support their bodies through the various stages and challenges of life. As research in nutrition and women's health continues to evolve, staying informed about the latest findings and recommendations is crucial. Regular checkups and open communication with healthcare providers can ensure that supplement choices remain appropriate and beneficial over time. Thank you for watching this comprehensive guide on essential nutrients and good supplements for women. We hope you found this information valuable and that it helps you make informed decisions about your nutritional health. If you'd like to learn more or explore high-quality supplement options, visit nutritionmarket.com.au. We have a wide range of supplements and a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to get personalized advice on your nutritional needs. Don't forget to hit the like button and subscribe to our channel for more informative content on health and nutrition. Remember, while this video is based on scientific research, it's for informational purposes only and should not replace professional medical advice. Some of the findings discussed may still be under investigation, so always consult with your healthcare provider for personalized recommendations. Thanks for watching, and here's to your health.